A new study came out that said if your heart rate is more than 75 beats per minute, you might be at risk for sudden death. But is that hope or hype? I'm Dr. G, and we'll break that down coming up at 5.
And it's a study that would make any middle-aged man take notice. Your heart rate could predict your chances of having a heart attack.
Well, this study by the New England Journal of Medicine says a high resting heart rate could predict your chances of dying. But does this simple test offer hope for predicting sudden death, or is it just hype? Local 2's health troubleshooter Dr. G takes a look.
Read the headlines. Take your pulse. If it's more than 75 beats a minute and you're a man in your 40s or early 50s, your life may end suddenly. Well, I read that and it scared me. So I took the study to Dr. Verinder Mathur, a cardiologist at the St. Luke's Heart Institute. Well, his initial response:
do not panic, even if your pulse is 80.
That's because when he broke the study down for us, of the 5,713 men tracked over a 23-year period, 81 died of sudden death. Granted, the average resting pulse rate of this group was higher, but when you work the numbers, that turns out to be less than 1%. Instead of a high resting heart rate, Dr. Mathur warns people to look out for other warning signs, like unusual fatigue or shortness of breath during normal activities. If you're healthy and you're exercising and you see some change,
it is a very important clue to go and get checked.
So is the story hope or hype? Well, Dr. Mathur took my resting heart rate just to be sure.
I'm sorry to tell you, Pawan is 88.
So what does that mean? Should I panic? Am I going to die?
No, that's the whole point. That if your pulse is more than 75, it doesn't mean a thing.
Are you sure your watch is working? Maybe you should check it again. So it's hype. While Dr. Mathur does point out that the study provides some very interesting observations, but before it can be applied to an individual patient, it has to be confirmed by more studies. Now, heart rate and the pattern of response to exercise is important, and in fact, that's really what doctors use when they do a stress test on a patient. Now, however, many doctors say that the best way to prevent a sudden heart attack is regular exercise.
Yeah, it always comes down to that, doesn't it? It does. Got to read behind the headlines. Thanks for clearing that up, Dr. G.
Well, talk about...
Well, you might remember about a month ago, a widely hyped study from the CDC that said if you're overweight, you're not at greater risk of dying than people of normal weight.
And I remember this, Dr. G, because you said that was wrong, and guess what? Now the government is agreeing with you. So let's take another look at what you said.
It's definitely hype because bottom line, forgive the pun, the study did not say that being overweight will make you live longer or healthier. But a lot of groups like Consumer Freedom are spreading this misinformation. That's doing more harm than good. Yeah, I went on to tease Bill about his fondness for Whataburgers. He went out and got one right away. But in all seriousness, the head of the CDC now says that she's sorry for the misleading data.
To predict preterm births, Dr. G has more on a simple test that can tell women their chances of going into premature labor.
Monica Bertram has her hands full, but she wouldn't have it any other way.
I've always said I would have 10 if I could.
Monica's last child was born premature, so when she became pregnant with her second child, her doctors were worried and kept a careful eye on her.
It's a very helpless feeling when you go into preterm labor and them telling you, you have no more control.
This time around, a simple test gave Monica control.
Fetal fibronectin is a test that is used to give us an idea of whether a patient is at higher risk or lower risk for preterm delivery.
The test measures a protein that holds the baby in place during development. The test is very much like a pap smear, using a simple swab to obtain a sample. The sample is then processed in about an hour. If the test is negative, there's less than a 1% chance of the baby being delivered prematurely. If positive, doctors can take action so that the baby doesn't end up here.
We will bring her to the hospital many times. We'll certainly give her steroid shots to help accelerate the maturity of the baby.
The test is routinely used on women who are at risk for preterm delivery. Expectant mom Jennifer Falker was worried because she has a genetic risk factor.
What a great option and a great way to alleviate any anxiety.
The test worked for her. It came back negative and she's still very much pregnant. It also worked for Monica. Her second child was born healthy, full-term, and happy.
Through that test, we were able to have the confidence to have her, because otherwise I don't think we would have gone through with it.
The fetal fibronectin test is about 97% accurate and can be given throughout a woman's pregnancy, starting at 24 weeks. The test is FDA approved and is covered by most insurance companies. On the Health Beat for Local 2 News, I'm Dr. G.
is there another explanation to what happened to him?
Well, some scientists believe that this is just a physiological response. It's a lack of oxygen to the brain which causes a near-death experience.
Houston Dr. Pavan Grover has been fascinated with near-death experiences for years.
Scientists have actually stimulated a part of the brain and been able to recreate a near-death experience. People seeing light, having kind of a life review.
But he says medicine can't account for everything these patients see.
What these scientists can't explain is how people, when they die and they have an out-of-body experience and they can describe what's happening like half across the hospital, and there's no way that they could know that.
Local 2 medical expert Dr. G did not treat Shoemaker and doesn't know specifically about her diagnosis, but says...
Now, thank you for joining us, Dr. G.
You're welcome.
We are told that...
Whether or not Terri Schiavo is getting them has become something of an issue in this case.
Again, Dr. G.
You're welcome.
Jennings is having chemotherapy right away. What does that suggest to you?
Dr. G, you touched on this in your report. Now, the FDA has the power to control prescription drugs, but why not something like ephedra that was sold over the counter and has been linked to so many health problems?
Well, Bill, here's the deal. Now, the federal laws are different for supplements. For example, in prescription drugs, the burden of the proof is on the manufacturer to show that the drug is safe. However, in this case, for supplements, the burden of proof is on the FDA to show that a drug is harmful. To show you how big of a hurdle that can be, the FDA looked at peer-reviewed studies, they looked at reports of injuries, and even about 150 deaths. But even then, the ruling was upturned. Besides the health benefits, the kids say it's a lot of fun, too.
In the short time I spent with the kids, it was obvious that they all wanted to be there, and each was confident and had a strong sense of identity.
So, Bill, you can't go for that extra cheeseburger.
Oh, man. I thought I was home free this time.
I'm going to have to be the food Nazi here. No cheeseburger.
One day they have this study, the next day it's this study, and I was banking on this stuff.
Yeah. I know you were
Bottom
happy
line,
about
no food for you,
right.
no cheeseburger for you.
No cheeseburger.
Thank you, Dr. G. An officer's daring move is caught on.
I just slathered it on. It kind of made me a little bit hot, but that's probably a different story.
Yeah, for another study, I'm sure. At some other time.
Yeah, that probably is a different story. As for hope or hype, it's not better than Botox.